I'm a neurologist at the University of Utah and part of the TeleNeurology program. And is this Dr. Jones and Sarah, the patient?
Yes.
Yes.
So,
Hey, Dr. Ansari, thanks for joining. As I told you on the phone, Sarah is coming in with almost 2 days now of pretty severe headache, which is new for her. And we did a CT scan. We didn't see subarachnoid hemorrhage, but wanted to involve you guys because of the rapid onset and severity.
excellent. Oh, I think it's very reasonable. I took the time, I reviewed the H&P and the labs that you sent over to us, thank you, and I saw the CT scan as well. Sarah, in your own words, can you tell me how the headache felt like when it started and if you had any warning signs beforehand?
Yeah, so I was out in the garden digging up radishes, and I got a sharp pain above my right eye, and then I felt like my entire head was about to explode. And then I couldn't see very well. I got kind of blurry vision and spots, and I don't really remember very much after that, just my sister bringing me to the emergency room.
Okay. Okay. And then either Sarah or Dr. Jones, when you were getting more information, seems like there was sensitivity to light. Was there also some element of unsteadiness and sort of dizziness, vertigo?
Yeah, I felt like I almost fell into my radish patch.
And did this also cause you some nausea, like you felt like you were going to throw up?
Not at the time that it started, but on our way to the emergency room, I felt nauseous.
And just going back to you before this headache, have you ever had headaches like this before?
I haven't, no.
And have you ever hurt your head or had any brain injury?
Not that I recall.
Any brain surgery or any reason to see a brain doctor ever in your life?
No.
Okay. And coming back to this headache, I understand it's been going on for about like 8 or 9 hours now?
Yes, that's correct.
Do you think it's getting better, getting worse?
I think it might be getting better, but it's throbbing, and I still feel blurry vision and maybe dizzy, a little dizzy.
Okay. And then have you tried to walk? Do you feel like you are teetering to one side or the other when you try to walk?
I feel like earlier when I took a walk with the nurse to use the bathroom, I teetered a little bit on the right side.
Got it. Well, Dr. Jones, it sounds very much like a migraine to me, especially in view of a normal CT scan. Sarah, do you have any history of migraines in your family? Anybody in your family that has been diagnosed with migraine headaches or takes medication for it?
My mother actually had migraines a lot while I was growing up.
Okay. And does she still have migraines?
She does.
Okay. All right. Well, Dr. Jones, let's do a quick exam. I think this is going to be a very normal exam, but it sounds like we have migraines as part of our differential. So, Sarah, would you mind just looking straight at the camera and opening your eyes wide, looking all the way to the right with your eyes, all the way to the left, all the way up at the ceiling? Good. Okay, you can relax. Have you had any double vision at all today?
Not really double, but blurry.
Blurry vision. Okay. Can you remove your mask for a second and just give me a big wide smile with your teeth? Good. Stick your tongue out, please. Okay, so now say ah. Okay, very good. That looks very symmetric. You can put your mask back on. Can you raise both your hands like you're holding up a tray? Good. Hold it a little higher. Close your eyes. Hold them there. Don't let them move. I'll count you down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Very good. Very good. Dr. Jones, could we check a finger to nose on either side, please?
Sure. Will you take your index finger, touch my finger, and then your nose? Go back and forth. Excellent. Good job. Other side.
Very good. All right. Sarah, can you uncross your legs and lift one leg up for me, please? Either leg. Okay, let's hold it up there. Okay, you can put that leg down. Can you raise the other leg, please? You can put that down. Okay, very good. Can we check sensation real quick, Dr. Jones? Sarah, you let us know if you feel the scratch equally on either side.
I do.
Okay, and then on the hands?
Yes, I feel it.
Very good. Very good. And so I'll just summarize. Sarah is a young, otherwise healthy woman who has a mom that has a history of migraines and is presenting with her first headache. It sounds fairly typical for a migraine, with the sense that it is throbbing, it's disabling, it's brought her to the hospital. It is associated with some mild nausea and sensitivity to light, sound, and unsteadiness of her feet, as well as some blurriness of vision. It's very reassuring, Sarah, that your head CT scan is normal, and the labs that I reviewed, which included CBC, BMP, liver function test, and drug screen, were all normal. So that's all very reassuring. Dr. Jones, can you just tell me briefly what sort of treatment we've given so far for the headache, both in the emergency room and here?
Yeah, so we gave her some Benadryl and Toradol through the IV. Dr. Ansari, I was wondering if we should do a lumbar puncture to rule out subarachnoid, and if you had thoughts on additional treatment as well.
Excellent. No, actually, I do have some thoughts. So as far as further diagnostic workup, I completely agree with you. In a new onset headache, we should rule out more sinister causes. So my suggestions as far as next step would be, let's do either a CTA or an MR of the brain with MRA to look for aneurysms. If we find an aneurysm, then definitely we should do an LP just to confirm that there's no subarachnoid hemorrhage. But if we don't find aneurysms on the CT angiogram or the MRI, MRA, then I feel like a lumbar puncture may not be necessary. Unless I'm missing anything, would you have any other concerns besides subarachnoid hemorrhage for the LP?
No, I was just kind of taught in residency that I did a CT and a lumbar puncture, but wanted to run it past you. We can get a CT angio for sure.
Yeah, I think that getting an LP is very, very useful, and I think that if the MRI, MRA, or the CT angiogram show any suspicion of any lesion, then please go ahead and schedule a lumbar puncture. I think that as far as further workup, I wouldn't have anything else beyond that. I think the labs that I see and the CT scan that I see and the angio that you will do will be sufficient. As far as treatment, I think what you have given so far is very, very effective. You've given a non-steroidal. I would also suggest giving just a little bit of Zofran. I think that it really helps in this situation. You could give her 4 milligrams or 8 milligrams IV. And you could also give her like a liter of IV, just crystalloid fluid bolus. That will also help in this situation. If the headache continues to improve and the further workup for the aneurysm is negative, then I don't foresee that she should be in the hospital longer than 24 hours. I think that we would want to counsel you for migraine headaches. Sarah, if your mom has migraines, then this could be the first migraine for you, especially if the aneurysm workup ends up being negative or normal. So if you do get more headaches like this, then you can take some over-the-counter medications to prevent them from getting worse. And what I would suggest is as soon as you feel this kind of a headache starting, please get as much rest as you can. Drink a lot of water. Gatorade will be very useful. You can also drink a can of Coke or soda, and caffeine in the soda will help. I would recommend a prescription for Zofran as an outpatient doctor, just so that, Sarah, you have some Zofran available to take. And then you can take over-the-counter migraine Excedrin, and 2 pills of that should be very, very effective in helping treat your headache. Does that sound reasonable?
Yes, thank you so much, Dr. Ansari.
And then after discharge, please do schedule a visit with your primary care doctor. A primary care doctor should be able to manage your migraine. And then, of course, Dr. Jones, if anything comes back on the CTA, the MRI, or the LP, then feel free to consult us again, and a scheduled consult tomorrow, and we can review those studies on the LP and the CTA. If you have any urgent questions before then, feel free to call us back, especially if you find subarachnoid hemorrhage.
Sounds good.
Does that sound reasonable, Dr. Jones?
Yeah.
Sarah, any further questions?
No, thank you so much.
Dr. Jones, would you mind readback verifying our plan? Because my note that I'm going to document won't be available in your system till tomorrow morning.
Sure. So we're going to add some IV Zofran 4 milligrams to the headache treatment. We'll get a CT angiogram of the head, and if we see an aneurysm, we'll do a lumbar puncture. Otherwise, we'll give Sarah a prescription for Zofran, and she'll follow up with her primary care doctor, and we'll also give her a liter of saline before she goes.
Excellent. I think that all sounds very, very good. Thank you all for the consult, and Sarah, good luck.
Thank you.
Thanks.